This is Dr. Mikki again with Medrine Health and Aesthetics. So this video is in continuation of the filler introduction video that was just posted prior to this. So this video I'm going to go over a little more depth of the areas and the type of filler I like to use to take care of it. So we'll start with again forehead. So when do I use forehead fillers? We don't use it very commonly, but it again depends on what the client needs during the consultation. So we evaluate. I feel like I'm an artist, and when I'm looking, I try to see where they need what kind of treatment. So if they're having indentation or hollowness in the forehead, filler could be a good idea. Yes, it does have some risk complications, but if done right, it is very safe. I like to use cannula technique if there's an indentation or like a big line or a fold. It's hard to treat with the lasers or with Botox, then filler could be a good idea. So using cannula technique, we go under subcutaneously, deep dermis, and try to place it right on your frontal bone. Okay. So what this does is minimizes the indentation or the hollowness, gives a nice fuller forehead appearance. What filler would I like to use? Again, fillers come in different thickness, which I mean is there's some very hard fillers to somewhat hard and soft fillers. I like to use soft fillers such as Versa or RHA2, which are nice and soft, easy flow. They settle in well in this area. Okay, so that would be my choice of fillers to do the forehead. And the next thing would be temple. Okay, so that would be this area. So as we're aging, we notice big hollowness in the temple area. So it's very good to rejuvenate, to fill the hollowness with again a filler. There's different options. We could even use Sculptra, which is a collagen booster, to do the temples. Or filler would be a quick results. You can see it pretty quick, instantaneously. Again, need to be careful the position we choose, and again the filler that we pick. So again, I like to pick in between consistency. Again, I like to go with Versa or RHA3 to fillers to do this area. So it gives a nicer, softer appearance than hard appearance. Okay. So once the temple's done, then the other very commonly done area is cheek. I like to only limit to cheek fillers when you have very flat or no cheeks. Fillers, the way